Hello everyone, welcome here. Welcome to our first live session with Dr. Mohit Aggarwal, the medical oncologist at Fortis Hospital, Delhi. And as discussed earlier, Mr. Aggarwal is going to talk on breast cancer prevention and risk factors. So over to Dr. Aggarwal.
Hello friends. So I've been trusted upon the job to talk about breast cancer, which is one of the most common malignancies in ladies. So I would like to bring about some facts about it. First of it being that though it is the most common malignancy in females, it is not that it cannot happen in male. So even a male can have a breast cancer. However, it is much more rare in that aspect. Now, if we talk about breast cancer, there are a lot of factors which actually affect them. So you can have some genetic risk factors, and as we all know that the case of Angelina Jolie, that these factors are those which are basically non-modifiable and they are in your genes. But if one fits into those criteria, then one needs to get screened frequently to see for them. The other risk factors are related to our lifestyle. And what are those factors? Those factors can be something like early menarche, late menopause, which are basically inherent, inbuilt. You cannot do much about them. But the modifiable risk factors are like late childbirth, at not indulging in breastfeeding, or obesity, sedentary lifestyle, or something like an over alcohol consumption. So these are some of the modifiable risk factors which needs to be modified so that as to decrease the risk of breast cancer. Now, if I talk about the sign and symptoms, the breast being a peripheral tissue, the sign is usually a lump, and which is most common in the breast parenchyma, but the lump can be there in the armpit as well. So one can have a breast lump in the breast lump or in the armpit. There might be an arm swelling. There might be a swelling in the breast. Also, there might be some changes in the nipple areolar complex, or there might be some skin changes like a puckering. Now, these are some of the signs and symptoms when the disease is localized. However, if the disease has spread, then the signs and symptoms would actually depend upon the organ to which the disease has actually spread. So if it has gone to liver, one can develop a jaundice. If it has gone to brain, even one can have seizures or other neurological symptoms. Other symptoms might be an abdominal distension or any other complaint as aspect to which organ has been affected. So how do we actually prevent it or screen it? Now, prevention is something which is very big topic, in which the most important factor would be our change in the lifestyle. Now, what would be the lifestyle changes? It would be at an appropriate age of marriage and appropriate time of childbearing, indulging in breastfeeding, and having doing regular exercises and leading a healthy life with not indulging in addictions like alcohol. Other thing to be seen here is something known as screening. Now, screening, how does it help is that if one develops a breast cancer, it would be caught up at a very early stage, and at that stage it would be very much curable rather than only controllable. So what are those screening methods? We have something like a self-breast examination, which every lady should do after an age of 25. So what do we need to do is that monthly we need to stand in front of the mirror and use these three fingers, the palmar aspect of it, and palpate the breast in a circular motion, going from periphery to the center, so that we can actually feel the lump. Mind it, we should not go feel it like this. We have to feel by this surface. So any change in the contour or any lump would be felt early, and it would be caught up early. So if some change is there, then you need to consult a doctor. Another screening method would be a very important screening method which we usually do not do is mammography, which is nothing but sort of a breast X-ray. So any women above the age of 45 or even 40 should do an annual mammogram. An annual mammogram is just like an X-ray of breast, which would actually pick up any of the lump or the suspicious area in an X-ray image. And if that is there, then one needs to consult a doctor for the same. Now, if supposedly all this is detected, then what further? One would be really, tensed that one would have to undergo a lot of painful procedures and a lot of costly investigations. But it is nothing like that. The doctor would confirm your radiological findings and would just do a needle test, which would be in the form of FNA and biopsy. Here comes the other myth. People feel that once they put a needle into the tumor tissue, the tumor would actually spread. But this is not the case. This FNA or biopsy, the needle diagnosis and treat further. So once the diagnosis of breast cancer is confirmed, further on we need to stage the disease, for which the patient would be undergoing some scans, either a CT scan or a PET scan or some chest X-ray or ultrasound. This would define whether the patient would be fitting into the early stage or into the late stage. If it is the early stage, it is very much curable. So the patient would undergo a surgery and subsequently some treatment either in the form of chemo or hormone therapy or radiotherapy, and the patient is going to get cured. And now meaning by cured means that the patient is going to live the entire life what has been given to the patient by the God. There is no cutting of life because of the disease. The second thing is, even if the disease is in the advanced stage, one needs to take into consideration that the treatment modalities are such that the longevity of the life and the quality of life is very much improved. And the treatment might be just in the form of a pill, in which the patient might take a pill and keep on continuing with the pill as you treat a hypertension or a diabetes. So we are into a very new era of treatment where we have multiple modalities, a better modality in terms of surgery, in terms of radiation techniques, in terms of medical treatment, which would include chemotherapy, hormone therapy, and something like a targeted therapy, which has lesser side effects. So we are into the era where we need to be actually doing more screening, leading a more healthy lifestyle. If the disease develops, picking it up early so that we are actually into the curative mode rather into a palliative mode.
We are waiting for some questions. Let's wait.
So guys, if you have any questions, please put in your questions and Dr. Aggarwal can answer it now.
So which age group is basically prone to breast cancer?
So the age group can be basically, there is no critical age group which is actually not possible to have a breast cancer. In India, what we see is that there is early breast cancer also in ladies of 20s and 30s. However, as the age increases, the chances of breast cancer is much more. So with the age increasing, the most common age group would be around 50 to 60. So age is one of the risk factors. As the age increases, the chances of breast cancer increases.
Sir, there's another question and it says when you should start screening for breast cancer, typically for people who have a family history of it.
So one should ideally start at the age of 20 to 25, and if, as I said, that the mammography is indicated after the age of 40. However, whenever the index case has been detected, it should be 10 years prior to the detection of the age of the index case. So prior to the age, supposedly someone has developed a breast cancer at the age of 40 and is known to have such sort of hereditary factors, then the screening protocol should be much more stringent, and a stringent protocol should be started at the age of 30.
Okay, and the other question says, how does breast cancer treatment affect female fertility?
So breast cancer treatment actually affects fertility, but there is no single treatment to breast cancer. There are some, one might be only treated with surgery when there will be no issues regarding fertility. However, chemotherapy and some chemotherapeutic drugs have much more problems regarding fertility. And there are chances that the lady might not be able to bear a child in later stages. So what we usually do in such situations is that there are methods of preservation, fertility preservation, in which we do a cryopreservation of the egg or the ovary, in which in those scenarios, if the lady wants to do a childbearing, then those eggs can be used in care for the similar situation.
Okay, and the third question says, does obesity increase the risk of breast cancer?
Obesity would certainly have an impact on breast cancer because when you have more of fat, your estrogen levels in the body are much more. And breast cancer is a hormone responsive tumor. So the estrogen level in the body increases and the chances of developing a breast cancer increases. So obviously obesity has an indirect effect on breast cancer.
So, what will you suggest to a woman who is in her early 20s and has been diagnosed with a first or second stage breast cancer?
I would say first of all, please consult a doctor. First of all, don't go into any alternative mode of treatment because if somebody has been developed with detected with stage 1 or 2 breast cancer, it is an absolutely curable disease. So you should undergo a mammography, you should undergo a scanning. Don't be afraid of an FNA or a biopsy because it is much needed to confirm the diagnosis. Subsequently, one would require a surgery, and then those surgeries, the ladies have a problem that obviously it would affect them morphologically because of the outside contouring. But let me tell you that today the techniques are so good that we have reconstructive surgeries in which the outside morphology is developed in the same way. There are techniques in which the nipple areolar complex is spared so that the breast morphology is not changed. So the appearance of the lady does not change. So one needs to undergo a surgery for that. And the further treatment, whether it would be chemo, hormone or radiation, would actually depend upon the tissue which has been taken out. So one need not be afraid. It is all a transient process taking about 6 months of entire treatment and you are cured for life.
Thank you so much, doctor. That was really informative. So, any further question, guys?
So, let's wrap up the session now.
Okay, so then we wrap up. Thank you so much for your time, doctor.
Okay,
So,
my pleasure.
thank you for watching, guys, and see you again next week. We'll update you the time over email and we'll be sending you the invites. We'll catch you on some other topic so that you can be more aware of some common ailments that are affecting the society today. Thank you very much. Thanks.